Are you taking omega-3 every day, but still wondering if you are using it the right way to protect your heart, improve memory, and reduce joint pain? Do you know that simply changing the time you take it can double your body's ability to absorb and use omega-3? So, should you take it in the morning or at night? And if your goal is heart health, brain health, or joint health, is the timing the same? This video will give you the complete answer from the science of absorption to the optimal timing for each health goal, along with a step-by-step plan to turn omega-3 supplementation into a consistent, effective habit so you can not only stay healthy today, but also protect your long-term health for years to come. Omega-3 is a group of polyunsaturated fatty acids that play a vital role in the body's life-sustaining functions, yet the human body cannot produce them on its own. This makes it essential to obtain them through diet or supplements to maintain optimal health. Nutrition and medical experts worldwide agree that omega-3 is one of the most influential nutrients for heart health, brain function, and the musculoskeletal system. A key feature of omega-3 is its unique chemical structure, which allows it to integrate into cell membranes, support anti-inflammatory responses, and regulate many critical physiological processes. The omega-3 group consists of three main types: ALA, EPA, and DHA. Each type comes from different food sources and serves distinct biological roles. ALA, or alpha-linolenic acid, is commonly found in seeds and plant oils such as flax seeds, chia seeds, walnuts, canola oil, and soybean oil. It is the most prevalent omega-3 in plant-based or vegetarian diets. However, ALA is only a precursor that the body converts into EPA and DHA, and this process is highly inefficient, typically less than 10% in adults. For this reason, relying solely on plant-based ALA makes it difficult to meet the body's EPA and DHA requirements for specialized heart and brain function. EPA, or eicosapentaenoic acid, is found mainly in cold water fatty fish such as salmon, mackerel, herring, sardines, and tuna. EPA is well known for reducing systemic inflammation, lowering the risk of blood clot formation, and improving lipid profiles, especially by reducing triglycerides, an important factor in preventing atherosclerosis and coronary artery disease. In people with rheumatoid arthritis, EPA supplementation can also reduce pain and improve joint mobility by lowering the production of inflammatory mediators. DHA, or docosahexaenoic acid, is also abundant in fatty fish and fish oil and can be found in certain types of marine algae. DHA makes up a large proportion of the brain and retina structure, playing a critical role in maintaining cognitive function, memory, and healthy vision. For pregnant and breastfeeding women, DHA is essential for the development of the fetus's and newborn's brain and eyesight. Prolonged DHA deficiency can lead to cognitive decline, reduced learning ability, and vision problems. Epidemiological and clinical studies have shown that adequate omega-3 intake provides significant health benefits. For cardiovascular health, omega-3 helps lower triglycerides, reduce blood pressure, improve endothelial function, regulate heart rhythm, and decrease the risk of atherosclerotic plaque formation, thereby lowering the risk of heart attack and stroke. For brain health, omega-3, especially DHA, supports neurotransmission, protects nerve cells from oxidative damage, and helps maintain mental sharpness as we age. For the musculoskeletal system, omega-3 reduces joint inflammation, eases morning stiffness, and improves flexibility in older adults or those with chronic joint disease. The richest sources of omega-3 are fatty fish, but for individuals who do not eat fish or have seafood allergies, purified fish oil or marine algae oil supplements are effective alternatives. Incorporating ALA-rich foods such as flax seeds, chia seeds, and walnuts into the daily diet, alongside EPA and DHA from supplements or food sources, can help optimize omega-3 intake. Understanding the characteristics of each type of omega-3, the foods that provide them, and their specific biological roles is an important foundation before identifying the best time to take them. This ensures that each person can choose the right source for their health needs and that every dose of omega-3 is absorbed and used as efficiently as possible to achieve long-term protection for the heart, brain, and joints. Omega-3 has long been recommended by reputable health organizations such as the American Heart Association, AHA, the World Health Organization, WHO, and numerous nutrition associations for its wide-ranging and well-documented health benefits, particularly for three critical systems: the cardiovascular system, the brain, and the joints. These are not just community beliefs, but effects that have been clearly proven through hundreds of clinical trials and scientific reviews. For cardiovascular health, omega-3 is considered one of the most powerful nutrients for heart protection. One of its key mechanisms is the ability to lower blood triglyceride levels, a form of fat that, when elevated, increases the risk of atherosclerosis. Omega-3 also helps modestly raise HDL cholesterol, the good cholesterol that transports excess fat from artery walls back to the liver for processing. EPA in omega-3 inhibits platelet aggregation, reducing the risk of blood clots, which are a direct cause of heart attacks and strokes. Research has also shown that omega-3 can slightly lower blood pressure in people with hypertension, improve endothelial function, the inner lining of the arteries, allowing blood vessels to dilate more effectively, and maintain healthy blood flow. Notably, omega-3 also helps stabilize heart rhythm and reduce the risk of dangerous arrhythmias, especially in patients with a history of coronary artery disease. For adults over 50, the age group at highest risk for cardiovascular disease, adequate omega-3 intake can serve as an important protective factor, helping extend lifespan and improve quality of life. For brain health, DHA, a key component of omega-3, makes up over 40% of the brain's fatty acids and is an essential structural element of nerve cell membranes. DHA not only supports membrane stability, but also directly influences the transmission of nerve signals, impacting memory, learning ability, and processing speed. Epidemiological studies show that diets rich in DHA help reduce the risk of cognitive decline and Alzheimer's disease in older adults. In addition, DHA and EPA help reduce neuroinflammation, a factor believed to contribute to the progression of many neurodegenerative diseases. For people over 50, adequate omega-3 intake supports mental sharpness, helps stabilize mood, and lowers the risk of depression by influencing neurotransmitters such as serotonin and dopamine. Some studies have also found that regular DHA supplementation in adults can improve sleep quality, which indirectly protects the brain from the harmful effects of stress and chronic sleep deprivation. For joint and musculoskeletal health, EPA and omega-3 functions as a natural anti-inflammatory. Once in the body, EPA is converted into lipid mediators that help reduce the production of cytokines and prostaglandins, two groups of compounds that trigger inflammation and joint pain. In patients with rheumatoid arthritis, omega-3 supplementation has been shown to decrease pain levels, reduce morning stiffness, and improve mobility. Omega-3 also helps maintain the smoothness of joint fluid and protects cartilage from rapid degeneration. For older adults, whose joints often suffer from aging, chronic inflammation, or osteoarthritis, maintaining adequate omega-3 intake not only eases symptoms, but also supports daily flexibility and physical function. Importantly, these three areas of benefit, cardiovascular health, brain health, and joint health, are closely interconnected. A healthy heart ensures the brain receives sufficient blood and oxygen, helping preserve memory and alertness. A healthy brain supports motor coordination, balance, and precise movement, reducing the risk of falls and injuries. Healthy joints allow older adults to stay physically active, and regular activity is a key factor in protecting both heart and brain health. Omega-3 acts on all three systems simultaneously, creating a comprehensive shield of protection, particularly valuable for those over 50, when the risks of heart disease, joint degeneration, and cognitive decline all increase. Beyond these well-documented primary benefits, omega-3 also offers additional advantages, such as supporting eye health thanks to the high concentration of DHA in the retina, reducing dry eyes and eye strain, promoting skin health by maintaining moisture and reducing inflammation, and improving certain immune parameters. These added benefits further reinforce the value of consistent omega-3 supplementation, making it an important part of proactive healthcare. In essence, omega-3 is not just another dietary supplement, but a biological toolkit that helps protect the body from some of the most common and serious conditions of middle and older age.
By understanding the specific mechanisms of each type of omega-3 and recognizing its wide-ranging benefits, individuals gain stronger motivation to maintain consistent intake, building a lasting foundation for long-term health.
Principles for taking omega-3 for maximum absorption. To gain the full benefits of omega-3, choosing the right timing and method of intake is just as important as selecting the product type or dosage. One basic principle that many people overlook is that omega-3 fatty acids are fat-soluble, meaning they must be taken with a source of healthy fat to be absorbed effectively. The chemical structure of omega-3 consists of long hydrophobic hydrocarbon chains, so when they enter the digestive system, they require the aid of bile and lipase enzymes to be emulsified and broken down before passing through the intestinal wall into the bloodstream. Taking omega-3 with a meal containing fat stimulates greater bile secretion, which enhances emulsification and significantly improves absorption. Clinical studies comparing omega-3 absorption when taken with a high-fat meal versus on an empty stomach or with a low-fat meal have shown that blood levels of EPA and DHA can be twice as high when taken with a healthy, high-fat meal. This confirms that taking omega-3 alongside a meal rich in healthy fats not only improves absorption but also optimizes its biological effects. Healthy fats can come from many natural food sources, including avocados, nuts such as almonds, walnuts, and cashews, seeds like flax and chia, cold-pressed oils such as extra virgin olive oil or canola oil, and fatty fish like salmon or mackerel. If you take omega-3 in the morning, a slice of whole grain bread with avocado or a salad dressed with olive oil can be ideal. For lunch or dinner, you might pair it with fish dishes, lean meats sautéed in olive oil, or stews containing nuts and beans. Another factor affecting absorption is the chemical form of omega-3. Supplements on the market are often in either ethyl ester or triglyceride form. Research shows that the triglyceride form is typically absorbed more efficiently, closely resembling the natural form found in food. For maximum effectiveness, choose products labeled as triglyceride or reesterified triglyceride. Temperature and storage conditions also influence the quality of omega-3. Polyunsaturated fatty acids are highly sensitive to light, heat, and oxygen, which can cause oxidation and degradation if stored improperly. Omega-3 should be kept in a cool place, away from direct light, with the container tightly sealed after each use. If refrigeration is recommended, follow the instructions to preserve purity and potency. Consistency is another key principle. Whether you choose to take omega-3 with breakfast, lunch, or dinner, aim to take it at the same time each day to maintain steady levels in your bloodstream. Stable EPA and DHA levels help sustain the protective effects for the heart, brain, and joints at their highest potential. Finally, be aware that omega-3 can interact with certain medications, particularly blood thinners such as warfarin or high-dose aspirin. If you have chronic health conditions or take medications regularly, consult your doctor before starting omega supplementation to ensure safety. Understanding these principles will not only help you get the most value from omega-3, but also prevent mistakes that reduce its effectiveness, maximizing its long-term health benefits.
Best time to take omega-3 for different health goals. Not everyone takes omega-3 for the same reason, and the timing that delivers the best results can vary depending on your specific health goal. Understanding your priorities will help you choose the most effective time of day for your body to absorb and utilize omega-3. Whether your goal is overall wellness, heart health, brain function, or joint support, each has an optimal timing based on the body's circadian rhythm and physiological processes. For overall health, if your main goal is to maintain general wellness and balanced support for the heart, brain, and joints, taking omega-3 with breakfast or lunch is a sensible choice. Early in the day, the body is ramping up its activity, metabolism is faster, and energy demands are higher. Taking omega-3 during this period, together with a meal containing healthy fats, allows the body to absorb and distribute EPA and DHA more efficiently to vital organs like the heart, brain, and muscles. For older adults, taking it with breakfast also helps establish a consistent routine, making long-term adherence easier. For heart health and cholesterol control, For those with lipid disorders, especially elevated triglycerides or high LDL cholesterol, the ideal time to take omega-3 is with dinner. This is because the liver's cholesterol production typically peaks at night, particularly during deep sleep. Taking omega-3 in the evening ensures that EPA and DHA are present in the bloodstream at the exact time when the liver is most active in lipid metabolism, helping regulate cholesterol and triglyceride synthesis more effectively. Several studies have also found that evening supplementation can reduce triglyceride levels more efficiently than morning intake, especially for individuals undergoing treatment for high blood lipids. For memory and brain function, the brain works continuously, but its demand for energy and nutrients to support cognition, memory, and information processing is highest during the day when we are learning, working, and engaging socially. For this reason, taking omega-3, particularly DHA, at breakfast or lunch is optimal. This timing ensures DHA is quickly absorbed and delivered to the brain, enhancing focus, memory, and mental clarity throughout the day. For individuals with mild cognitive impairment or at risk for Alzheimer's disease, maintaining this consistent timing ensures the brain receives adequate DHA during its peak periods of activity. For reducing inflammation and joint pain, in people with rheumatoid arthritis or osteoarthritis, symptoms such as stiffness and pain are often more noticeable in the morning after a night of limited movement. Taking omega-3 in the evening allows the body to use EPA during sleep to reduce inflammatory responses and improve joint flexibility by the next morning. Evening supplementation also helps maintain stable EPA levels overnight, a period when the body carries out many tissue repair and regeneration processes. This is why many patients report feeling less stiffness and more ease of movement upon waking when they take omega-3 at night.
For high doses or multiple health goals, in certain situations, a doctor may recommend a higher than standard omega-3 dose, such as more than 2,000 milligrams of combined EPA and DHA per day for conditions like high blood lipids or chronic inflammation. In these cases, splitting the daily dose into 2 portions, one in the morning and one in the evening, can improve absorption and help maintain steady blood levels. For example, someone who wants to improve memory and also control cholesterol might take part of the dose with breakfast and the rest with dinner. Dividing the dose can also reduce the likelihood of side effects, such as fishy burps or stomach discomfort, which may occur when taking a large amount at once. Consistency and lifestyle fit. Whatever your goal, the most important factor is maintaining a consistent time for taking omega-3 each day. The body responds better when nutrients are supplied regularly, rather than switching randomly between morning and evening. The timing should also fit your daily routine. If you often skip breakfast, it is better to take omega-3 with lunch or dinner to ensure it is always consumed with a meal containing healthy fats for optimal absorption. Consulting a healthcare professional. While these recommendations apply to most people, individual health conditions, medications, and dietary habits vary. Those taking blood thinners, blood pressure medication, or lipid-lowering drugs should consult their doctor to determine the safest and most effective dose and timing, avoiding potential drug interactions. For people with stomach issues, taking omega-3 with meals not only aids absorption, but also reduces gastrointestinal irritation. Choosing when to take omega-3 should not be a random decision. It should be based on your health goals, your body's circadian rhythm, and professional medical advice when needed. When taken at the right time, omega-3 delivers its maximum benefits, supporting a strong heart, a sharp mind, and flexible joints well into the later years of life. Consistency when taking omega-3 for best results. Whether your goal is heart health, improved memory, or reduced joint inflammation, the most important factor for long-term effectiveness is not just the dosage or the type of product you choose, but the consistency with which you take omega-3 every day. Unlike painkillers or fever reducers, which can produce immediate effects, omega-3 requires time to build up in cell membranes, tissues, and the bloodstream. Research shows it can take several weeks to several months of consistent supplementation before EPA and DHA levels in the blood reach optimal levels and maintain their protective effects on the heart, brain, and joints. To build a daily omega-3 habit, the first step is to choose a fixed time of day for taking it. This makes it easier to remember and turns the act into a natural part of your routine.
For example, if you decide to take it with breakfast, keep the omega-3 bottle in a visible spot on the dining table or near the condiments you use regularly. If you take it in the evening, place it near your water glass or alongside other supplements you take before bedtime. Linking your omega-3 intake to another familiar daily action, such as your morning coffee, lunch, or evening toothbrushing, can further reduce the chance of missing a dose. You can also set reminders on your phone or smartwatch, especially in the early stages of establishing the habit. It is also important to continue taking omega-3 even when you feel healthy, as it is a preventative nutrient designed for long-term support. Many people stop once they feel well, but doing so can cause blood levels of EPA and DHA to drop quickly, erasing the benefits that took weeks or months to build. If you travel frequently for work or leisure, carry a small bottle or blister pack of omega-3 to avoid missing doses. Soft gel capsules are generally stable at room temperature for short periods, but if you are in a hot environment for an extended time, use an insulated bag or store them in a cool place. Consistency not only ensures maximum biological effectiveness, but also allows you to better monitor how your body responds and assess the real benefits over time. Once the habit is established, omega-3 supplementation becomes a seamless part of your proactive healthcare strategy, helping you maintain a strong heart, a sharp mind, and flexible joints for years to come. Taking omega-3 correctly is not just about the right dose and timing. It also involves choosing a high-quality product, storing it properly, and ensuring safety when combining it with your diet or other medications. The following tips will help you maximize effectiveness and minimize risks, especially for people over age 50.
Choose a high-quality omega-3 product. Not all omega-3 supplements are created equal. The differences lie in the source of raw materials, manufacturing process, purity, and chemical form of omega-3. You should prioritize products made from fish caught in cold, clean waters and certified by independent testing organizations such as IFOS, International Fish Oil Standards, USP, United States Pharmacopoeia, or GOD, Global Organization for EPA and DHA omega-3s, to ensure they are free from heavy metals, PCBs, and other contaminants. Whenever possible, choose the triglyceride or re-esterified triglyceride form instead of ethyl ester, as research shows triglyceride forms are absorbed more efficiently and closely resemble the natural form found in food. Check the actual EPA and DHA content. When reading a supplement label, many people focus on the total amount of fish oil rather than the actual content of EPA and DHA. For example, a capsule labeled as 1,000 milligrams of fish oil may contain only 300 milligrams of EPA and 200 milligrams of DHA, with the rest being other fats. To meet recommended intake levels, you should calculate based on the combined EPA plus DHA content, not the total fish oil amount. Store properly. Omega-3 is highly sensitive to temperature, light, and oxygen, and can oxidize easily, leading to a fishy smell and reduced potency. Store supplements in a cool place away from direct sunlight and keep the container tightly sealed after each use. Some liquid fish oil and soft gel products may require refrigeration after opening to maintain freshness and purity. If the capsules develop a strong fishy odor or an unusual taste compared to when first purchased, it may be a sign of oxidation and the product should be replaced. Take with a meal containing healthy fats. As discussed earlier, omega-3 is fat-soluble, so it should be taken with a meal that includes a source of healthy fat to improve absorption. Healthy fat sources include olive oil, avocado, nuts, and fatty fish. This is especially important for individuals with fat digestion issues or those who have had their gallbladder removed. Be aware of drug interactions. Omega-3 has antiplatelet properties, which means it can enhance the effects of blood-thinning medications such as warfarin, heparin, or high-dose aspirin. This does not mean you can't take omega-3 with these drugs, but you should inform your doctor so they can adjust the dosage and monitor clotting parameters if necessary. Additionally, if you are taking blood pressure or lipid-lowering medications, omega-3 may enhance their effects, and medication doses may sometimes need to be adjusted. Avoid prolonged high doses without medical supervision.
Some people believe that taking high doses of omega-3 will deliver faster results, but this is not true. Excessive doses, over 3,000 milligrams of combined EPA plus DHA per day without medical supervision, may increase the risk of bleeding, digestive issues, or nutrient imbalances. For most healthy adults, a daily intake of 1,000 to 2,000 milligrams of EPA plus DHA is safe and effective unless a higher dose is specifically prescribed by a doctor for a medical condition. Combined with a healthy diet and lifestyle. Omega-3 works best when combined with a balanced diet rich in vegetables, fruits, whole grains, and lean protein sources. Limiting saturated and trans fats, maintaining a healthy weight, and engaging in regular physical activity will further protect heart, brain, and joint health.
Following these guidelines will not only help you gain the full benefits of omega-3, but also ensure long-term safety, reduce the risk of side effects, and make sure your investment in health delivers the best possible return. We've covered all the essential knowledge about omega-3, from its definition and the roles of ALA, EPA, and DHA to its powerful benefits for the heart, brain, and joints. We've also explored the principles for maximum absorption, the best timing for different health goals, the importance of consistency, and practical tips to boost effectiveness and ensure safety. The most important takeaway is this: how you take omega-3 determines more than half of the benefits it delivers. This is not just general advice, it's backed by solid scientific research. Taking it with a meal that contains healthy fats, choosing the timing based on your specific health goals, maintaining a daily routine, and selecting a high-quality product, these are the 4 golden rules you can start applying today. Begin by evaluating how you currently take omega-3. Are you taking it at the right time? Are you pairing it with a meal that has enough healthy fat for proper absorption? Has your product been verified for quality and purity? By making small adjustments in these areas, you can significantly improve its effectiveness without increasing your dose. Heart health, mental sharpness, and physical mobility do not come from luck. They come from consistent, healthy habits maintained over time. Omega-3 is one of the most powerful tools you can use to protect these vital functions as you age. If you found this information valuable, share it with friends and family, especially those over 50, so they can apply it and protect their health as well. And don't forget to hit the subscribe button so you won't miss upcoming videos, where we'll continue to bring you accurate, up-to-date, and practical medical insights to help you take charge of your heart, brain, and joint health. Every small change you make today can create a big difference in your future well-being. Start today. Take omega-3 the right way, at the right time, and make it a long-term habit. Lasting health is the most precious gift you can give yourself, and we'll be here to support you every step of the way.